So a clinical trial is the way cancer researchers basically advance care for patients. It's the way we learn what treatments are the best by usually putting them head to head against what we thought was the best treatment. So this is the way we move forward in our cancer care by offering the latest and greatest therapies. There are two reasons, most importantly, why we offer cancer patients clinical trials. The first one, I think, is the obvious, that we're giving them a chance to get access to perhaps the newest, latest, greatest treatment before it could be even FDA approved, and we would have a chance to prescribe it for them. The second reason is really altruistic. I mean, yes, we want the clinical trial to benefit the patient, but the other most important, or the second most important thing perhaps, is that what we learn from that trial can be important for patients in the future. I'm frequently asked whether clinical trials are safe, and the first thing I would tell patients is clinical trials are extremely regulated, frequently by the government and governmental agencies, to make sure that everything being done is according to the best standard of care. And so there's a lot of oversight and a lot of headache in getting a clinical trial active so that we can offer it to patients. So there is an incredible amount of oversight there. So yes, they are safe. The other aspect of that is the medications they're getting, because they're investigational. Are those safe? In most cases, those drugs have already been researched, and usually the researchers have a pretty good idea about the side effects. And there is always a little chance, I think, patients have to take in a drug that's so new to the market. But still, it's not like they're unknowns. Nobody usually is getting something nobody else has ever had before. So in determining whether patients are eligible for clinical trials or not, basically there's a long list of inclusion and exclusion criteria that we have to look at to see whether or not they qualify for any particular trial. And so basically we're looking at things they have to get on the trial, and then also things they can't have, perhaps like bad liver function or kidney function that would exclude them from the trial. So in considering the risk and benefits of a clinical trial, I think the first thing is the patient wants to look at what the risks are associated with the particular medication or treatment that they're being offered on that clinical trial. And usually that's spelled out in incredible depth and detail to the patient at the time they enroll. I think the benefits are primarily that they can get access to advanced care that is not yet FDA approved or available, but 6 months or a year from now may be what everybody is getting. The way cancer clinical trials contribute to advancing care for patients is really the same way that the World Series contributes to how you determine who the best team is in baseball. Most of the time we're putting the current standard of care treatment head to head in a battle, so to speak, against what we hope will become the new standard of care. And without patients participating in these trials, we can't advance cancer care.